Okay, hi there. Today we're going to go ahead and demonstrate a urinalysis, in-office urinalysis. So before we get started, I'm just going to kind of show you everything that you would need set up. I have, of course, the urine, which I would not touch without gloves, but this is not real. Gloves. We have our urine dipsticks. I'm also going to show you how to do an hCG pregnancy test here. We have a draw straw for transport, if need be. Our sharps container, because of the draw straw, has a needle in it. And then, of course, our bio bag to send off our specimen to the lab. All right, first and foremost, we're going to go ahead and make sure that our sheet, I'm using a sheet. Normally, you would probably either run this through an electronic machine or type it into an EHR, but I'm using a sheet for just purposes of the video to make it a little easier. I'm going to go ahead and make sure I have my patient's name properly on here. Today's time and date. And the time currently is, okay, our provider's name, and then of course my name. All right. So first and foremost, we're gonna get our gloves on after we have washed our hands. Okay. And then we're going to take a look at the urine. Now, some clinics will have you do this, some will not. But oftentimes they want you to note color, clarity, and odor. So the color here, this particular color, colors can range anywhere from light yellow all the way to amber, which looks like dark beer. This, I would say, is a dark yellow. Okay. The clarity, I can just kind of look through it, through the light, and I can actually see the label on the other side. That means it's clear. If I couldn't, that would be cloudy. And then as far as odor goes, I can go ahead and take the lid off, and no, you don't have to stick your face in it. You just waft it like a fine wine, and you'll smell it. The smells can range anywhere from a slight odor all the way to pungent. And pungent, you can barely get the lid off and you will smell it, trust me. All right, so once I have that all taken care of, I'm gonna go ahead, and the first thing I'm gonna do is I'm gonna show you the draw straw. Now, we don't always do this, kind of like on the video for strep. This is kind of a just in case if the provider decides they wanna send it off to the lab. But this is basically a device that allows me to put the urine into a tube and send it to the lab. If the provider wants you to go ahead and do that, then you're going to want to go ahead and do that first, because that is going to be the most sterile. Be very careful with these, because inside right here there is a needle. It is sharp. Don't stick your finger in there. That would be silly. Okay, so we're going to go ahead and uncap this. Always be very, very careful when you're uncapping your urine. You don't want to spill it. This will go right into the urine, and then you will just take the tube, pop it on, and urine will flow steadily into the tube. And because this tube has a vacuum in it, you just let it go until it stops. And that will be full. Go ahead and pop your tube off. Okay. Give it a couple of inversions. Don't shake it. A couple of inversions. Go ahead and put this into your sharps container. Just drop it. Okay. The inversions mix the urine with the additive that's in there. And then we're going to go ahead, we'd label it, put it into our transport bag, and either put the order in electronically via EHR, or if we have a paper requisition, it would go into this little pocket here, and that gets sent off. Okay. Next, now that we have it open, we're going to go ahead and grab one of our test strips out. Okay, the test strips look like this. And we will go ahead and get this lid back on here real quick. And we're just going to dip this into the urine. Okay. Just for a second. You don't have to soak it. Okay. Just make sure all the little squares get urine on them. Give it a little tap. I just go ahead and lay it on top of the cup. That way if it drips back into the cup. And then we're going to go ahead and pick up our bottle. And this bottle shows 30 seconds at the bottom for read, 120 at the top. If you haven't already watched my lab and point of care testing video, please watch that. This will explain a little more, okay? I'm gonna wait about 30 seconds, which in my talking has probably gone by. And I'm gonna start at the bottom with the glucose, which is also the bottom of the strip, closest to where I was holding on to it. And what you don't want to do, you don't want to lay this on the bottle to compare it. You'll get urine on the bottle and you're going to be using the bottle again. Okay. You also want to have what we call a pee pen because your hand might have urine on it, which mine does actually. And you're going to get that on your pen. And the last thing you want to do is take this pen out and use it for other reasons. So we usually had, when I was in field, we had a little bucket in the lab that was pee pens. And when we're done with them, we just put them back in the bucket, and then when we come back, we grab it again, okay? So I'm gonna go ahead, and I'm just going to go ahead and compare the colors. Now, if you notice on here, the colors are different shades on each line. And basically what you do is just compare them, and whichever one is closest, that's the one you mark. My sheet is also situated just like the bottle is. All right, so we're going to go ahead and we're going to start at the bottom with glucose. That's that. Okay. And you'll just go up and up. And if you lose track, you can just count squares. I've done that before. You're going to go up and up until you get to the top. And by the time you're at the top, it'll be about 120 seconds has gone by. So that's why we start at the bottom. Okay. All right. And last. Perfect. All right. And then at that point, we can go ahead and we can set that aside. We're going to go ahead and take our strip, and that is going to go into the biohazard bin over here. Okay. Go ahead and make sure that we have marked out all the results. And if that is all we're doing, then we're going to go ahead and show this to the provider. They will go ahead and check it out. They'll probably initial it if it's on paper. Otherwise, it'll be sent in the EHR. And that would be the end of that. We would take and dispose of the urine. And disposal of the urine is one of two places. If your lab in your office has a clean and dirty sink, you're going to go to the dirty sink to dispose of body fluids. If you only have a clean sink in your lab, then you will need to take this back into the restroom, dump it in the toilet, and flush it, obviously, and then go ahead and take the cup and throw it into biohazard, okay? I'm not going to do that just yet, though, because I'm also going to show you how to run a pregnancy test. This is the pregnancy strips, and just like in my other video with the strep, the directions are right on the inside of the lid, which is beautiful. This particular one, and always make sure you look at them because each manufacturer is slightly different. This one says to dip for 5 seconds and then read at 3 to 4 minutes. So we're going to go ahead and open this up, pull the strip out. Okay. And it looks very similar to the strep test from my strep video. It's got the little wavy lines at the bottom. So we're just going to go ahead and put that up to the line that is above the wavy lines. You'll notice that the section in the middle will start to turn a different color. I don't think you can see that, but I'll show you here in a moment. Okay, it's probably about 5 seconds. We'll go ahead and just lay that there and let that continue to run. Let me just pick it up and show you real quick. I don't know if you can see that, but it's darkening in the center there, turning kind of a pink color. We'll just let that go. And then, of course, at 3 to 4 minutes, we would go ahead and read it. Very similar to the other rapid tests where you have one line on top, no line on the bottom is a negative, 2 lines is a positive, line on the bottom, no line on top, or no line at all is an invalid, which means something is wrong with the test or you didn't get enough specimen. Okay, so we'll say 3 to 4 minutes has gone by. We do have the 1 line at the top, no line at the bottom. This indicates a negative test. We would mark that on our sheet as negative. This will go back into the biohazard. I would go ahead and dispose of my urine and let the provider know the results. Go ahead, remove my gloves, wash my hands, and we are all done. Thank you so much.